When you're looking for KitchenAid innovation and quality, who has the answers, the selection, the price? Ventura TV Appliance. With billions in nationwide appliance buying power, more than Home Depot and Best Buy combined, we'll help you save. Our low prices on Energy Star qualified KitchenAid appliances save you energy and money, and pay no interest on select models when paid in full within 12 months. Ventura TV Appliance, serving you since 1951.
Hi, I'm John Mallos. Welcome to this live edition of Connect with me on the showroom floor at Ventura TV on this day. Hey, glad to have you along. Today is the Focus on Business. It's Tuesday. Also, the expert is in the house. He's an expert, and we're going to focus on a brand new business that he opened last year. You know the phone number by now, 436-MeTV, option 11. Back in a moment.
Tonight I want to discuss the importance of the television medium to the American people.
Had the day off yesterday on tape, but back here live on the showroom floor on this Tuesday morning. And the focus, of course, is on business. And so we're glad to be back live on Comcast Channel 187, 43.6. We're here for the full hour, 60 minutes, 10 to 11 o'clock in the morning now. Of course, our show expanded to an hour a while back, and you can call in at 436-MeTV, option 11. A special guest today. He's an orthodontist. He's been here before, has not been in our studio in quite some time. You might recall the last time he was here. Well, this is a man who has expanded his business. He opened another office in the town, the small town of Clovis. I want to take you to the videotape and roll it, show you what I'm talking about here. This is the latest location, a state-of-the-art orthodontist office that opened up last December. And the owner is 40-year-old John Bayrakdarian, who's been practicing for more than 12 years. He works 6 days a week, 10 hours a day. Look at this state-of-the-art facility. Some neon lights, it looks like. They're very colorful inside, with green being the main tone. And yes, making enough money now to handle one office in Fresno, two in the town of Clovis. But he's there to help you as well. He's not just a dentist. This man is an orthodontist. He straightens out teeth by performing dental and facial surgery if and when needed. In other words, he can straighten out that smile of yours, the smile that you've been unhappy with for so long. He works on kids as young as 6 years old, my friends. And he says, at least he told me, it's never too late to get something done. He also helps those who are in their late 60s and early 70s. So you see, it is never too late. With the new technology, these procedures get easier and easier by the minute. This is the new Clovis location that opened up last December. One of the patients there he's consulting with. You are going to consult with him today here on the air. Live in our studio right now is Dr. John Bayrakdarian to answer your questions. He is here to take your phone calls, 436-MeTV, option 11. If you've got something that you're unhappy with your smile, or your teeth are a little off center, a little off this, a little off that, he can help you with that. 436-MeTV, option 11. Do call in. He's an expert, my friend, in the field. We're back in just a moment.
Frigidaire. We introduced the first home freezer, the first pulsator agitator washer. And now we introduce the Frigidaire Orbit Clean dishwasher, designed with a unique wash arm that gives you 4 times more water coverage for a consistently better clean. Frigidaire, over 90 years of legendary innovation.
See the full line of Frigidaire appliances at Ventura TV Electronics and Appliances.
So the man has been here before, and he is here again. How are you, Doctor?
Good, good. Thank you. Thank you
good.
for having us.
Yeah, thank you. I appreciate it. So this new office that you opened up in last December, it's a beauty, huh?
It is.
The theme is really the color of your shirt.
That's right. It is the lime green. 10 years ago we introduced that, and it's still in fashion.
Yeah, I want to roll a piece of videotape of the grand opening that took place just not that long ago, about 6-7 months ago.
Correct.
And why did you open up a third office? You already had 2 of them. Business is doing well. Did you see a need for this third office, and why?
Mainly, it's the patient's convenience. Basically, the third location is located at the Buchanan High School, just walking distance from elementary school. So it's
Okay.
the most convenient to the parents and patients to come in for their regular appointments. One of the main reasons, and that's beautiful location and
Yeah.
state of the art, as you said.
Who are the majority of your patients? Your list makes up patients that range in age from what to what?
As you said, the ranges basically from ages 6, or I would say 7 till 70 or more.
But the majority of them are
Majority
younger?
of them are younger. I would say 50% almost are teenagers that have braces on, and that's the majority.
Yeah, they're unhappy with their smile. They're unhappy with maybe a crooked tooth or whatever. And they come in.
All combinations. Happy with their smile, not being self-confident of their smile, and the way that their teeth are. Basically, that's and the parents, they want to have. It's not only the beauty of the teeth, make them straight, also the functionality at the same time.
Yeah, this is the
working on.
grand opening that we're looking at right here. This is not really the facility. The grand opening taking place last December.
Correct.
Why did you choose that particular location? Because of its proximity to Buchanan?
Proximity to elementary and Buchanan high schools, yes.
And a lot of those people, they come over, huh?
They come over. They walk, walking distance. The only thing parents have to do is come for an exam and sign up for the treatment, and then they can let their kids or teenagers walk to their appointments, which.
I want to roll another piece of videotape inside the new facility, the brand new facility. I want to see the new one that just opened up here. And I want to talk to you about, because when I was a kid, if you had crooked teeth, you had braces on, but it really wasn't common practice the way it is now. Why is it such common practice now to go in at 5 or 6 years old and straighten out your teeth? I didn't have that when I was a kid, really.
Yes, you're right. Years ago, I would say 20, 30 years ago, or more than that, we had orthodontics has been different than what it is now.
In what way?
In a way that the treatment approach, one. Number two is the bracket system. In the past, they used to have bands on each and every tooth wrapped around, and that wasn't very beautiful. Nowadays, we do have direct bonding or smaller brackets and wires that
What are we looking at here? The video up there.
We're looking at the new location. Actually, through the windows, you can see the school.
Yeah.
The elementary school of the whole Buchanan neighborhood, and that's nice location, relaxing atmosphere. The colors, watching the cars and everything, and it's fun. I've never seen any patient that comes to the office and says, "Wow, I don't like it." So.
Right. I want to get back to some patient video. Do you have any video that has patients? I want to see some patient video here, because I do want to talk a little bit about the procedures that you do perform. I did mention, of course, in the monologue that you perform dental surgery. Do you?
I do not do dental surgery.
Okay.
My profession is orthodontics. What we do is that orthopedics. What we do is that specialty of orthodontics and dentofacial orthopedics. So.
Now here's a patient here, and explain what you're doing.
What I'm showing to the patient is the X-ray machine, the panoramic X-ray machine, which is, of course, nowadays it's digital, less radiation, showing about the crowding of the teeth and the wisdom teeth, how they're coming in, and what's the next procedure we're going to do, and treatment plan. The patient, what's the length of the treatment, and what appliances we have to use, and yes, and everything is clear. And we do show also at the same time animation of teeth, how it is before and after, and patients when they're at the office, they're always well informed of what's the procedure, what to expect. And nothing is hidden. Everything is explained pretty well.
Okay, so what are the treatment options if you're not happy with your teeth? What do you offer?
We do have, of course, the orthodontic treatment that includes the braces or Invisalign. The braces are the traditional wires and the brackets that we put, as we've seen here on the models there.
Yeah.
And the Invisalign, in certain cases, they are candidate for it. And we can straighten teeth with sets of trays that are computerized and programmed to align teeth and make them straighter.
Invisalign is what?
Invisalign is, as I mentioned, it's
Okay, hold that up so you can hold that up to the camera there so they can see. It's
clear.
kind of
It's clear.
clear plastic, almost. It looks.
That's right.
Like
And looks
It
like
comes off.
retainers comes off,
Okay.
and we'll put it in. And the patient has to wear it 23 hours a day, and takes it out only when they eat and brush their teeth and put it back again. And those trays would be changed once every 2 weeks. And it depends on the severity of the case. Then that's
Does the
length of
retainer
treatment.
have to be clean as well?
Yes, of course. Yeah.
Okay.
Yeah, but they don't need to eat with the trays or the Invisalign trays, we call them.
Okay, why are only certain people able to wear that kind of a tray on their teeth?
If it depends, as I said, if teeth are severely crowded or missing teeth, and certain cases we have to do extraction cases, which I do feel comfortable of using the traditional braces, more control. That's my way of approaching for the treatment.
Okay, if now these are the traditional. I'm going to hold this up.
Yes.
These are the traditional braces that you see here. That's kind of the modern day brace, I guess you would say.
That's right. Yes.
So today's teenagers probably don't want this, do they? They
do,
probably.
they do.
Oh, they do. They don't mind
also,
this
they
anymore.
don't mind that. They love to change even colors.
Really?
So, for example, we do have the clear braces as well, ceramic braces.
Okay.
And they do change the colors once every 4 weeks or 6 weeks.
Right.
So-
But do teenagers nowadays, like high school kids, do they like this look right here with the traditional brace look, or would they rather go with the clear?
Some of them, they rather go with the Invisalign. Others, they would like the traditional.
Really?
Why? The reason is that some of them, they don't like to have to remember always. They have to take the tray out and put it back again,
Yeah.
whether or not they lose it or not. And they have the braces on, and it's there. It's doing its job.
Right, but this isn't, it's not exactly a fashion statement, by looking at this, you know what I mean? Because it's kind of
No,
old and
certainly, yeah.
traditional,
Well,
and,
the
we
ol-
always, in fact, when I was going to school, we used to make fun of kids who had braces. You remember that?
Oh,
Remember that? Oh yeah, you got braces, ha ha ha.
Well,
so.
in old days, let me show you here. In old
Yeah.
days, we had the bands that goes all around the teeth, individual in each and every tooth. That was the old braces.
Yeah, you had that
Nowadays-
wire band, right?
Wire band all
Yeah.
around. Nowadays, we have only small brackets that barely visible
Individual brackets on each tooth.
on each and every tooth. So
Wow, unbelievable. All right, time to take a break. We're going to be back with our show here. If you have any questions for our guest today, the doctor is in the house. He will answer any of your tooth or mouth-related problems. 436-METV, option 11. Back in just a moment.
Don't you ever hit me again!
Chief, I think we got a hit on our hands.
MeTV Fresno, now on Comcast Channel 187.
Back here with our guest today talking about orthodontics and straightening out your teeth and your smile. Let me ask you a question, probably unrelated, but I'm going to ask it anyway since
Yes.
you're kind of in the dental field. What do you do about bad breath? Can you fix that?
bad breath. Well,
Does that have anything to do with someone's teeth? If you have bad breath, does that come from someone's teeth, or the fact that maybe they don't brush as often as they should, or what? What
You're
is the
right, yeah.
cause of bad breath?
well, a lot of reasons. I cannot pinpoint exactly what's
Give me
the
some
cause of
reasons
it.
that.
One of them, I would say, is of course the basics is brushing, the oral
Right.
hygiene, but brushing and flossing, and the second I would say is the gum, the condition of the gum tissue or the gingiva. You might have some gum disease there that has to be addressed, and if there's any infection there, gingivitis or periodontitis, then that's need to be addressed by the specialist, who are
What takes care of that problem? Antibiotics or what?
different approaches again. Antibiotics and deep cleaning and sometimes surgery. It all helps. So we do have in the dental field periodontic specialties, which is like the same as orthodontics, braces. We have the periodontics that they will take care of that.
Caller, you're on the air. Go ahead.
I was looking on the video just now, and I saw the Invisalign trays that the doctor was demonstrating, and it looks just like a bleaching tray. Can these be used simultaneously for whitening of the teeth as well as straightening of the teeth? There's a question for it. And I've got a second question, too. My second question is regarding the old-style brackets. Did you still use the arch wire that we're accustomed to from orthodontia in the past, or has that been modernized? No, there's new brackets. That's great. But what about the arch wire? That's my other question. Thank you.
Good.
Okay.
Good questions, two of them. First one I can answer is the neither the Invisalign trays and nor the regular trays, which are sometimes we call them Essex trays, you cannot use them for bleaching. And the reason is that those trays are adapted very tightly to the surfaces of the teeth, and there's no room to put any kind of gel or whitening gel inside the tray and use it as whitening. If you do that, then you might first cause damage to the trays, and second of all, the material that the bleaching material would slip into the gums, and it's not good to have kind of acid going into the gum tissue. For the second question, whether or not what kind of bracket system we use and the wires, is the wires are on a daily basis, on monthly basis, we do get new kind of wires that are more efficient, more flexible, and they don't distort. So those are the things that are different from the past, that they didn't have the flexibility. For example, years ago they used to use stainless steel wires and very thin ones. Nowadays we do use nickel titanium wires, which are very flexible. You can even twist them with your hand. So that's the difference. And we go progressively from very thin and flexible wires into thicker and stiffer wires over a period of weeks and months. And sometimes patients don't even feel that there's any pain or discomfort.
Yeah. Another call coming in. Good morning. You're on Connect with Me. Oh, you got to turn down your sound. Okay, we'll have to call back. Sorry. Caller, the one that just called in, if you are listening, you are going to hear a delay coming through your television set, so you do have to turn your sound down before you call in. Call back at 436-MeTV option 11. We are here with the doctor in the house. So there are different variations of using the wire system. There are different kinds of wire. There's a stiff wire, a soft wire.
That's correct.
As I understand it.
Correct.
Is that
and
correct?
Not only the stiffness and the stiffness, it's the size of the wire, the thin wire and round wire, and then we go into more into square or rectangular wires that give more control, adapt to the bracket system.
Right. Right. And so I just want to clarify now, with the Invisalign, you cannot use those as a dual combination to whiten your teeth and straighten your teeth.
Correct.
Is that correct?
Correct. You cannot.
Why is the conflict there? Why can't you do that?
As I mentioned, is the trays are very tightly adapted to the teeth, and there's totally no room created for the
bleaching.
For the bleaching. Yes.
Okay. Yeah. All right. Call coming in. Good morning. You're on Connect with Me.
It's live TV.
Yeah, you've got to turn down your. No, we got to go. We got to turn down the sound. Let me reiterate this a couple of times. If you do call in, and I know you're out there watching, please turn down the sound before you call in, because there is like a 10-second delay on your television set, and we're sitting there waiting, and we get feedback, and we can't hear you. So if you just decide to pick up the phone and call 436-ME-TV, option 11, glad to take your phone call, folks, but we can't take it. If your television set is up, we can't hear you. So that being said, call back again and gladly take your call here on the air. Let's roll another piece of videotape from the brand new facility. I don't know if we can show some patients here. We've seen enough of the facility itself. I want to see some patients if we have any. And so this is you working on a patient, I believe, yesterday. What
Correct.
kind
Yes.
of what kind of procedure are you doing here?
Well, this particular patient, she's been in treatment for almost 2 years, and the procedure that I'm doing is that we removed her braces, and I was at that patient cleaning the cement and making the teeth smoother.
Right.
Yes.
Caller, go ahead. You're on the air. Keep that video going.
Good morning, this is Linda.
Hi. Go ahead.
I had a question for the orthodontist.
Yeah, go ahead.
My daughter had treatment for about a year. She now has retainers. She does have the wire retainers. So a little bit uncomfortable for her. I've heard there's permanent, or I believe permanent retainers. I'd like to know the pros and cons.
Sure.
Okay.
All right.
Thank you.
It's an option. Actually, our office that we provide to almost 90% of all our patients, a fixed retainer, especially on the lower arch or lower teeth. The reason is that the fixed retainer is very thin wire that holds the front 6 teeth all together, and it doesn't allow teeth to move. And the chances are much less of teeth shifting or moving during any kind of function, eating and chewing on certain things. And of course, the removable retainer, the patients would wear them at night. As far as the pros and cons of the fixed retainer, I just mentioned the positive signs. The negative is that they won't be able to floss all the way. Why? Because we do have a wire that holding each individual teeth, 6 teeth, but the alternative for that is I recommend to use the water pick to clean the area in between the teeth.
So the disadvantage is thoroughly cleaning the teeth.
Correct.
With
yes.
that fixed retainer, right?
Correct.
Okay.
Yes.
All right. Caller, go ahead. You're on the air. Okay. Got to cut it. Sorry about that, but caller, you had your TV set up and we cannot take your call, so turn down the sound. We've had 2 callers now call in with their sound up on their television set. Cannot take it. There's a long delay between us and the TV set. So when you call in, turn down the sound. 436-ME-TV, option 11. Glad to take your call. The doctor is here to answer your questions. Back in a moment.
When you like Ventura TV Appliance on Facebook, it's nice. But when you love the Whirlpool appliances we deliver, it's even better. Our website is cool, and it's a good place to start, but you really should touch the merchandise before you buy. Touch the new Whirlpool Ice Collection. It offers a modern style made to create an inspiring kitchen experience. Save big on this Whirlpool Black Ice or White Ice kitchen. Come in to Ventura TV Appliance and touch the merchandise today.
Okay, just a reminder now, when you do call in, we're glad to take your phone calls, and so is the doctor here to answer your questions at 436-ME-TV, option 11. But please, my friends, you do have to turn down the sound or we cannot take your call. There's too much of a delay and a distraction and everything else. So we do have a call. Let's take it. Good morning. You're on Connect with me.
Hi, my name is Marie, and I'm from Fresno. My daughter, she's 7 years old, and she has very crooked teeth. She also has her baby teeth still. Her friend that she plays with in our neighborhood is only 8, and she already has her braces. Isn't that too young to put braces on a child?
Good question. It is recommended, not only myself, which I highly approve that, is by the American Association of Orthodontists, is to have an orthodontic checkup on each and every person as early as age 7. So the reason is that at that age, we do take a panoramic X-ray, which shows if we do have all permanent teeth, whether or not if we have any missing teeth. We do check the bite, the growth of the jaws, either the lower jaw or the upper jaw is growing more than the other. So in certain cases, I do recommend to start treatment at an early age, which we call it phase 1 treatment. And in other cases, I would say let's wait, let's put the patient on a recall basis, and once a year I would see the patient up until they're ready, age 10, 11, 12, it depends, and to start an orthodontic treatment.
So, but to directly answer her question, her daughter was 7,
Yes.
is 7.
Mm-hmm.
Is she too young for any treatment like this, braces or the Invisalign?
Invisalign is, I wouldn't recommend Invisalign. Braces, yes.
She can put braces on at 7.
If needed.
If needed.
If needed, yes. Not necessarily that they do need each and every person.
And you have to
braces.
go through a series of steps and tests to determine whether she can handle these types of braces.
Not necessarily. There are no steps here. It's
okay.
a one simple exam. It takes 5 to 10 minutes an exam.
Okay, and then you can tell her.
And I can tell the parents that whether or not they're ready for braces or they do need braces with certain appliances to correct the bite.
Right.
As we mentioned earlier on your show, that the specialty of orthodontics is not only braces, orthodontics and dentofacial orthopedics. What I mean by that is utilizing certain appliances, for example, face mask or expander appliance, to correct the jaw while they're growing and redirect it as much as possible.
Okay, so she's not too young.
Not too young.
Okay,
Not
she
too
can
young.
do it. And your address, in case the young lady who called in is watching, wants to bring her daughter in, is where? What's the address and telephone number?
Any address that of Unique Orthodontics, they can go on uniqueortho.com, our website, or phone number 222-2522.
Right, Unique Orthodontics.
Uniqueortho.com.
Okay. You mentioned that the Invisalign would be not proper to put on a 7-year-old, too young. Why?
We still have a lot of primary or baby teeth that are not totally in or erupted yet, and the Invisalign trays would be in the way for those teeth to exfoliate or fall down or prevent permanent teeth from coming in.
Okay, so the teeth have to be fully grown. You have to have
fully
mature
grown.
teeth.
Mature teeth, correct.
Okay, all right. Another call coming in. Good morning. You're on Connect with Me. Your question. Hello, caller.
Hello?
Yeah, you're on the air. Go ahead.
Just a second.
You're on the air. Hello.
Yeah, I have a question.
Okay, can you turn down the sound on your TV, please?
Hello?
Yeah, hello. Turn down the sound.
Yeah, I have a question.
Go ahead. We're waiting.
I have a son that is scared to see an orthodontist, and he has crooked teeth. And I was wondering, how would you make him feel comfortable enough to get braces in?
So let me clarify. You have a friend that her son is afraid to see an orthodontist or a dentist in general?
Orthodontist. He needs braces because his teeth are very crooked.
Well, first of all, at our offices for orthodontics or putting braces on, that's how we explain to the patients prior putting braces. We explain very thoroughly that we do not use any anesthetics or any needles in order to put braces on. I haven't used it for years. So
no anesthesia.
No anesthesia.
Okay.
No anesthesia for putting braces on or even removing them. So that calms down the patient, who are usually when they're afraid from orthodontists. I would say more they're afraid from previous experience that they had from a dentist, and they would relate that to orthodontics. But once we put the braces on, explain to them, we don't have any issues.
Yeah. Do you have a lot of families that bring their children in and they're hesitant or frightened, perhaps, because they don't know what to expect?
Correct. But once we give them the explanation and show them prior cases, or they would see on hand other patients seated down, almost same age and acting very normally, happy, so most of the time they change their mind right away.
Right, and you kind of calm their fears a little bit once you
Definitely.
show them what the
Yes.
procedure is going
Correct.
to be.
And
Go ahead.
yes, and I do have very experienced staff, registered dental assistants, that they would help with that, and they're very helpful.
Okay, another call coming in? No? Okay. Roll another piece of videotape here and show some patients. And I want to ask you about, the fact is, how do you determine, now here's a patient right here that you're, now these are x-rays, right?
Correct.
Okay.
So that's the digital x-ray that we're taking on this patient. That's the same patient that we did take her braces off.
Okay.
And we're taking final panoramic x-ray. And the reason with that, we do take before and after, the same for the photographs or pictures of the patient. And with that, we would check how her teeth are, the final result, and if whether or not we do have wisdom teeth are still inside the bone that needs to be evaluated for extraction. So same visit, I would give them referral.
Do you do
to
that? You extract the wisdom?
I do not.
Wisdom? Oh, you don't. You don't do that.
I don't
No,
give
no.
needles.
No. Okay.
Yeah, I don't give needles. So I would refer them to specialists, either to their dentist or the oral surgeon.
And you don't do surgery.
I do not
you
do surgery.
refer that out to
I
someone
refer-
else.
yes, yes, I
Okay. All right. No anesthesia, no needles. This is a safe place. There's no question. And so I want to ask you, on average, if you put on the traditional braces like this, okay, this is a traditional look that we all are familiar with. How long can you expect to keep these on?
On average, the braces, my average would be 1.5 to 2 years of treatment.
Okay,
That's on
so a year and a
average.
half, and these never come off. You brush your teeth with these.
They won't come out
They won't come unless you take them out.
Unless I take them out, or unless the patient doesn't follow certain oral
The
hygiene
instructions.
Yes.
I imagine you have some of those patients. They don't follow
Of course,
instructions
For
too
example, biting on an apple, which I don't recommend, that cut it in pieces and eat it instead of biting
well. Why
on an
is
apple.
that? Why?
The reason is the cement that we use to put the brackets on the teeth. We don't use very strong cement. Why? Because when time comes to take the braces off, with the strong cement, we won't be able to take it out. So we use medium force of cement, so that we can retrieve or remove the brackets after we're done with the treatment. So that's why we give instructions to patients that they have to follow certain oral hygiene instructions, whether or not, so that they won't break the bracket.
Right. So don't bite into an apple. Don't bite into a nectarine or some type
Something
of fruit
hard,
that's or a hard piece of candy.
Hard piece of candy, or biting on ice, or
Ice, yeah.
ice,
Ooh,
yes.
No, stay away from that for a
Yeah,
couple of
or
years.
sticky food, or caramel, or things like that. We give a big list of
No-nos.
No-nos, correct.
Yeah. Okay. And quickly, before we go to break,
Yes.
the Invisalign. How long do you have to keep that on that cup?
The Invisalign, it depends. It ranges between 6 months to a year or year and a half. That's the average.
Okay. The doctor is in the house. He's here to talk about his business. We'll talk to him more about his unique orthodontics in Fresno, 2 locations in Clovis. Back with your phone calls, 436-ME-TV, option 11. We're back in a moment.
Ventura TV Appliance Center. We're the save energy, save time, save money place. The Energy Star qualified #1 rated high-efficiency Cabrio from Whirlpool Place. You heard right. Right now, save big on select Whirlpool Cabrio laundry pairs and pay no interest when paid in full within 6 months. At the hometown low price, think outside the big box place. Since 1951, Ventura TV Appliance Center. We're working hard to be your place.
Call coming out of the break. Good morning. You're on the air. Go ahead.
Hi, my name is Cora, and I'm interested to know if there really is a difference between Invisalign and regular braces. I'm almost 23, so I'm actually considering treatment just because I'm not happy with my teeth, but I just really wanted to know if there's actually a difference or not.
Difference in a way of treatment, or difference in the length of the treatment?
I would say just like the end result, just because I would want to do what's best for my teeth. So
would it be better to do Invisalign or braces? Is it the same thing?
Well, yes. Certain
What
cases.
straightens your teeth out better, Invisalign or traditional braces?
They,
the end result, I
see,
guess.
it all depends. We have to diagnose initially what kind of occlusion or bite we have. I would say that, you know, if a person, in my opinion, candidate for Invisalign, the end result would be the same as the regular braces.
Oh,
so I
okay.
wouldn't say that one is better than the other. But if I see that we do have very crowded case or almost surgical case that, you know, no, I wouldn't recommend the Invisalign, and braces would be the option.
Yeah, you said that from the outset, because if you got a crowded mouth in there, that's not for you.
Not for the Invisalign.
It's not for the Invisalign.
Yeah.
You've got to go with the traditional brace, no question about it. Hey, we're going to put a disclaimer up real quick here. Do we have a call?
She's still there.
Oh, she's still. Oh, caller, you're still there. Do you have any other questions?
One more. Do I need to go to my dentist first, or can I just schedule a consultation?
No, you can.
Or
exactly, you can call us directly at uniqueortho.com or 222-2522. We can make an appointment or check
Slow
your.
that down.
Yes.
What number again is what?
222-2522.
2522.
Okay.
Yeah.
Thank you.
Thank you.
Okay, thank you. Good luck to you. Let's put that disclaimer up here before the end of the program and talk about the focus on business, of course, every Tuesday here on Connect with Me on Comcast, channel 187 and 43.6. We try to highlight businesses here in the Central Valley. They don't pay us, we don't pay them. We just try to give them a helping hand, just the way that we have been successful here since 1951. We offer the best to other businesses around the valley. So, Doctor, why did you decide to open up? I asked you that at the beginning of the show, but why was there a need for it? Is there such a, I guess my question is there such a demand for this kind of dental work, orthodontics? Is there a demand, especially here in the Central Valley, and what is that demand?
There is a demand, and I wouldn't say that it is strictly that people are waiting or line up to get braces on. No, there are other practices that do in orthodontics.
What's different about your business and better about your business than what other people might be offering? I know you said state of the art, but if you could be specific.
I wouldn't say that I'm the best. I would say that, you know, each and every orthodontist, they're doing excellent job. But the only thing I can tell about myself that, you know, what I do is that, you know, first of all, our makes us different is our customer service. We emphasize on that. At the same time, our fees are reasonable. We have payment plans. At the same time, we do offer all emergency calls that, you know, and different locations. So
yeah. Okay. Call coming in. Good morning. You're on Connect with Me.
Yeah, I thought of something when the patients call and they say, "Can you let the doctor know I broke off a bracket?" What's the number one food? I remember I used to hear pizza all the time, and I just wondered if that's still, I guess, because lots of kids eat pizza. That's my one question. I have a second question. The second question is regarding, you mentioned expander, and I guess you're talking about the palate expander.
Correct.
And that has to be done at a pivotal age when the kid's, I guess, hard palate is still forming, or is
not fused.
I guess in the process of forming or maturing. Do you ever use that procedure on adults? Can an adult go back and expand his palate after the fact, after the bone set, whatever? I don't know. This I'm just a layperson. I thought I'd toss it out there. Maybe you could answer it for me. Thank you.
Sure. Well, the first question is if you're eating something hard that we talked about and a bracket breaks, you know, usually they call the office and we would see them immediately, and we would take care of the emergency, and if needed, the same visit we change the bracket. If not, then but we make the patient comfortable and take care of the emergency. The second question is that, yes, you are right that the palate fuses at an early age. It's different from one individual to another, and even gender, you know, is different, male or female. Whether or not we can use the palatal expander on an adult, yes, we can use it, but we have to send the patient to a specialist, an oral surgeon. Literally, they would do a surgery, split the palate, and we can put the expander there and then utilize it. So that's the other option.
Okay, another call coming in. Good morning, you're on Connect with Me. Caller, you're on the air.
Hi, good morning. I have a question for the orthodontist.
Yeah, go ahead.
I'm here.
Okay, so, hello. I have a situation. So, myself, I've had braces 2 times already, and both times have been done by a different doctor, a different orthodontist. And still, my problem is that on my top front teeth, the way it initially started is one of them overlapped, and I can see that it's starting to overlap again. And that happened to me the first time. That's why I did braces a second time. I wear my retainers, and the retainers that I have is the clear ones. And I'm thinking, if I do braces a third time, how do I know that this won't happen again, or is it possible that it won't happen at all?
Well, yes, to answer your question, teeth are in a constant movement. Whether or not having braces on and then wearing retainers, during the day you're not wearing, I'm assuming you're not wearing the retainer, correct?
Not all the time,
Not all
like
the time.
I first was instructed, but I do wear them.
You do wear them. The one thing that I would recommend is, if possible, if there's enough clearance, to have correct the bite or correct the overlapping of the teeth, and have the orthodontist put a fixed retainer, which we talked about earlier, a fixed retainer that holds the front 4 or 6 teeth together, and on top of that you would have the clear or metal retainer, wear it at night. I think that would resolve your problem here.
So there's hope to
All
do
right.
it a third time.
Okay.
What's that again?
Well, I was just thinking out loud to myself that there's hope to do it a third time because I don't have any fixed retainer. I only have a removable one.
Yeah, that would be my best recommendation.
Yeah, so the fact that she's had it done twice. Yeah, thank you for the call.
You're welcome.
And good luck. It's Unique Orthodontics if you want to give the doctor a call. So the fact that she had this done twice, unsuccessful, she still can go back a third time and try to fix it, right?
Correct, yes.
Okay. All right. We're going to be back here on Connect with Me, 436-MeTV, option 11. If you want to call in, we still got some time. Plenty of time left in the show. Back in a moment.
When you're looking for Whirlpool innovation and quality, who has the answers, the selection, the price? Ventura TV Appliance. With billions in nationwide appliance buying power, more than Home Depot and Best Buy combined, will help you save. Our low prices on Energy Star qualified Whirlpool appliances save you energy and money, and pay no interest on select models when paid in full within 12 months. Ventura TV Appliance, serving you since 1951.
Back here on the program, Connect with Me, 436-MeTV, option 11. We got some time left in the show for the doctor. So let me ask you, we'll roll another piece of videotape. I want to talk to you about your background, your education. You went to the University of Pennsylvania. You went to dental school. So you went to Penn University, huh?
Correct.
How'd you like
yes.
it there? Did you play football over there? Or?
No time for football or nothing else. That's strictly school.
Strictly school,
That's
and
right.
you were a student, and that's pretty much it. Let's take that video full screen there so we can see what's going on, and we can talk about your education. What dental school did you go to here? As we're looking at, that's an X-ray, is it not? That's a
panoramic X-ray, digital one.
And, the latest in technology, is that correct?
Correct. Yes. I mean, it's been used lately, and
It looks like some scientific robotic machine that's from, like somebody's getting ready to go to outer space or something, huh? It's kind of neat.
Patients are comfortable. They don't. Haven't seen any complaints.
Yeah, no, that's great. And what about some people that are concerned about trying to limit their exposure to radiation? Talk about that.
With those digital X-rays, as the literature says, very, very less radiation than the original traditional X-rays, and I would say less than 10% or 5% of the traditional X-rays that we used to take. So that's a big plus here.
Okay. Getting back to your background, you went to dental school where?
I went to dental school at the University of Pennsylvania.
Oh, that's where the dental school was located.
Dental school,
okay.
yes. And then...
you did a residency in New York?
Well, prior
Rochester?
to that... correct. Prior to that, I did 1 year fellowship orthodontics in Nashville, Tennessee.
Okay.
And then 2 years in Rochester, New York.
Well, wow. Before you came here?
Correct, yes.
All right, okay. Caller, you're on the air. What's your question? Oops, you got that sound up. Okay, got to take another call. Sorry about that. If you're listening at home right now, you've got to turn that sound down on your TV set or you can't call in. We can't take your call. There's a big delay. There's confusion. We can't hear you. You can't hear us. Turn down the sound first, then call in. Okay, and so how many employees in your office here? Let's roll another piece of videotape. Maybe we can show some of the employees over at the office there. And you have 3 locations, 1 in Fresno, 2 in Clovis now. And employees are how many?
Employees, they range from administrative staff members and dental assistants and registered dental assistants. So I would say at least between 20 to 25 employees that they do rotate between the 3 offices.
Talk about the scheduling now, because, and here's another look at one of the x-rays there, not my teeth right there, I guarantee you.
It might be later on.
It might be later on, you never know. I'll ask this question after the call. Good morning, you're on Connect with Me. Hello, caller. Okay. Go ahead and turn it off, Marcus. Thank you very much. Caller, you've got to turn down that sound first and then call in second. You can't have that sound up. There's too much of a delay. So anyway, let me ask you, talk about the times of operation for your 3 businesses, because when one office is open, one might be closed. So talk a little bit about that so people know and they don't get confused.
We do have, as you said, I work 6 days a week, which
How do you do that? How's your wife put up with that?
That's okay.
She hasn't given you the heave-ho yet, huh?
No, she's okay with that. So I love what I do.
Yeah.
That keeps me going, and at the same time, if one office is open, the second one sometimes it would be closed or open at the same time. But I do have an associate that she helps me at the second location or whichever location is needed, so that both offices.
So you can have 2 open offices at the same time, but not 3.
If we have a third associate, yes, we can have.
You
3.
can have 3. Okay. We have a call coming in. I hope you have the sound turned down because we won't be able to hear you. Okay. Caller, go ahead. Nope. Sound is still up. Okay, we can't take the call. Go ahead and turn down the sound, then call back in. 436 MeTV option 11. I can't say that enough, Doctor.
Yes.
Well, yeah, you got to turn down that sound, or else you can't hear us. Please turn down the sound and then call in. So you can have all 3 offices open. Now, what I want to do is let's mention the location. Where are you located in Fresno? Give the address.
It's on Shaw, between Fruit and West.
Okay, it's close. It's pretty close to West, though, huh?
Correct. Yes.
Pretty close to West. I believe it's on the north side.
North side of Shaw.
Right, north side of Shaw.
That's our Fresno location.
Now, that's the original location?
Original location. That's where I started a small office there.
How long ago?
That was almost 7-8 years ago.
Wow. Yeah. Okay, so the second office that opened up is located where?
In Old Town Clovis.
Okay.
Old Town Clovis, right at the center there. And it's on Clovis and 4th Avenue, 4th and 5th.
And the other one is not too far away.
Not too far, a few minutes drive, which on Peach and Nice location.
Okay.
Intersection.
Right near Buchanan.
Right near walking distance.
Walking distance, Buchanan High School.
And as you've seen on the pictures, beautiful space, sitting down and watching the traffic and
How do you handle the 3 offices? Is it almost overbearing? Is it too much, or?
Never been.
It's not.
Never been.
Is it a matter of being organized as we look at the office here? Is it a matter of just staying organized?
The correct organization is number 1, and then the number 2 is that I do have excellent staff that supports me, and we work together to make it as easy as possible.
Right. Caller, hope you got that sound turned down. Good morning.
I do. Good morning. How are you guys?
Good.
Good morning.
Okay.
Hello.
Hi. My question was, I have 3 kids, but I'm missing
a lot of teeth in the front, and I take them to school. But my thing is this, like, is there any kind of, like, insurance? Like, well, I have no insurance, but is there payment plans? I am so desperate.
Okay.
I don't like walking my kids to school, and I'm, like, you know.
All right, I got 2 questions out of that. I think one of them is, do you have a payment plan? What's the other question?
Well, I would like to know how, like, you work, because I only make, like, $600 a month. So, do you guys, what kind of work can I do? I want to get some teeth. Thank you.
Okay. All right. So, apparently she's got a problem with one of her child, or one of her children.
Yeah. If
yeah, and she can't afford a lot of money.
Yes.
Okay.
There are programs that if depending on the insurance, Medi-Cal, if you are qualified under Medi-Cal, and certain cases are accepted through Medi-Cal.
Okay.
That's number one, which we do take at our office. The second thing is that we do have third-party financing. That even if you're not, if a person is not qualified, they might have someone else, a relative or a friend, that they can co-sign for them. And number three, we do have a very good payment plan at the office with minimal down payment and monthly payment plans. And those are the things that, all would be cleared once you would have an exam for your child and comes in, and we can decide whether or not ready for the treatment, and number two, the length of the treatment, and then the payment options.
But you never turn anybody away because they can't afford it. There's always Medi-Cal.
There's always something, it could be worked out.
All right. Yeah. Back with the show here on Connect with Me, Comcast 187, 43.6 in a moment.
When you like Ventura TV Appliance on Facebook, it's nice. But when you love the Samsung big screen we deliver, it's even better. Our website is cool, and it's a good place to start. But you really should touch the merchandise before you buy.
Time for that upgrade to an HD 3D web-enabled Samsung TV.
Get the best selection, price, and service in town without waiting. Come in to Ventura TV Appliance and touch the merchandise today.
From now on, when I sneeze, I'll try to sneeze more friendly.
The focus is on business today, and the doctor brought with him some photos of the inside of his brand new facility. Very interesting. And I just want to hold this photo up. I know you're not going to be able to see it that well, but there it is right there. I'll hold it as close to the camera as I can. Look at that. That's an arcade, is it not? You have an arcade, a video entertainment place for the kids.
Correct.
Look at that. Take the videotape and roll it, and we'll see it and that's it right there? Well, not quite. Next scene, I think the arcade will come up. Talk about that. So the kids go in, they have a place they can play while they're waiting.
They have iPads, they have touchscreen games, they have snowboard, and it's fun place, and parents love it also. And sometimes, believe it or not, I do see parents sit down there and then play with their kids in that space.
Okay,
and
that's it right there, right? Yeah. Is that it?
Correct. Yes.
Okay, so what do you have in there again? You have iPads?
iPads, touchscreen games, and snowboard. Literally, they can, get out there.
So it literally is state of the art to try to keep the kids entertained while they're waiting.
Correct.
That's pretty amazing. So, what? I mean, this had to be a little bit of a cost for you. What made you think of this idea to put this in here?
It's not always the patients themselves that they are waiting. It's their siblings also that they come with them. By the time they are treated or being seen, instead of sitting down and
annoying their parents.
Well, I'm not going to say that, but it's a good. I would love to go a place like that and take my kids there and have fun at the same time.
Right, right. So it kind of take the time. It takes up time right, to fit somebody with these. And during that time, the kids could be playing, they're not bored.
Exactly.
And they're not complaining. And you offer soft drinks too, or what?
Definitely, we do that. We
do?
have ice cream also.
You have ice cream also?
Ice cream, coffee, and yeah, it's...
Wow.
It's
okay, let me ask you something. What can you do for someone who loses a tooth? If they lose a tooth, or they're missing a couple of teeth, and they come in and they say, hey, what do I do about this? What do you recommend before you can do anything?
Well, each and every case is different. That's I don't want to generalize, but you know, on average, if patient is candidate for braces, I would recommend to have braces first and then replace the missing teeth. And meanwhile, while having braces
Why
on,
is that?
Since we're moving teeth, we have to create the space or keep the space. At the same time, during the treatment, I would give them fake teeth that are that close the space, and at the same time looks very aesthetically acceptable. And
so after the treatment, then you replace the teeth.
I wouldn't. I won't
or
replace
you send it out.
I send it out to the dentist or the specialist.
But step one first is straightening out the teeth.
Most of the time, yes.
Then replacing the teeth.
Correct.
Okay. All right. Now give out your phone number one more time. I believe I have it here. Go ahead and say your phone number and your website.
222-2522 and the website uniqueortho.com.
Okay. On any given day, roll another piece of videotape. Here it is right here. What are you doing up here? And I'll ask the question after you tell us what's going on here.
I am showing the parent that is standing there behind me that the certain primary or baby teeth that needs to be extracted to make room for the permanent teeth to come in, and circling the second molars that are ready to come in as well. These aren't the wisdom teeth, these are the second molars. So that shows also that, you know, we do have the touch screen and get the x-ray and show the parents visually what exactly is going on and what to expect from the treatment. And
so this is how you explain it to, you would explain it to a patient.
Correct.
Basically is what you're doing here.
Each and every visit is like that.
Yeah.
We do take an x-ray and explain thoroughly to the patient or the parent.
So that's a touch screen system that you're using.
Yes, it is.
Very state-of-the-art. So on any given day, from what I've gotten out of this whole interview here, this hour, this great hour that we've had with you, learning a lot about orthodontics, is that you cater to children. That tells me that the majority of your patients are children.
Correct. And I love children.
Isn't that right?
Correct, yes.
Okay, and the majority are between the ages of what, 8 and say 20?
I would say on average, I would say 9, 10 years old, 13, 14 on average. That's the main, I would say 50% the age of group of patients that I do see. But of course I do see from 7-year-old till 70 years old, if not older.
Right. Number one complaint for people that come in is what? Their teeth are crooked, they're yellow, they're this, they're that. What's the number one complaint?
Mainly is the teeth are not aligned, they're not straight. At the same time, they don't feel comfortable, they don't feel, they're self-conscious about their look or their teeth. And of course their bite, it's not correct, and so that's why
you can correct the overbite too a little bit.
Of course.
To a certain extent.
Of course, yes.
Every case is different.
Correct, yes.
Okay, we want to thank you for coming on. This is your second appearance here on Connect with Me.
Thank you for having me.
Yeah, and the number again is 222-2522, one location in Fresno and 2 now in Clovis, with that latest one opening up last December was the grand opening.
Grand opening, yes.
All right, Dr. John Bayrakdarian, and we thank him for being here on Connect with Me. Another program here tomorrow. We're going to be live here with Jim Franklin. He is the pastor at Cornerstone Church. Hope you can join us for the full hour tomorrow on 187 and 43.6. Have a great day.